very much for coming to this meeting. I just would like to talk to you about what's happening in sub-Saharan Africa while the world seems like it's imploding around us. We have a financier-induced economic crisis that Jeff just discussed, while at the same time there are communities in sub-Saharan Africa that are inexorably undaunted by all of the negative forces, undaunted by naysayers about development. They're basically showing very quietly what modest investments and evidence-based interventions with latest technologies and true partnerships, not partnership based on political expediency, but true partnerships, what all of these elements can achieve. The Millennium Village project is a project that has been designed by Jeff and some of us and his other scientists to show that, demonstrate basically that the Millennium Development Goals that we're all very familiar with can be achieved in spite of the cynicism of the world, international community. What we have done is we have chosen different agroecological zones and worked with communities in 10 different countries in 14 sites. The sites were chosen such that they would represent the different agroecological zones from the very dry all the way through savanna, tropical rainforest. So they represent all the different farming systems. And all of the countries where the 14 sites are complete partners with this on this project. Just wanted to quickly summarize, for some of you already know about this, and for some it's new, the main concept of the Millennium Villages project. The main thing is that this is a demonstration. It's a proof of concept that within 10 years, 5 to 10 years, under certain set of circumstances, the communities can get out from under extreme poverty, can actually get out of the poverty trap. The circumstances that, the hypothesis is that there is a package of integrated intervention. There isn't any one single bullet, but that it's a package of interventions in all the different sectors of agriculture, health, education, infrastructure, and business development. The most important concept for us is that all the interventions that we're helping the communities deploy are proven interventions. They're all practical, evidence-based, proven interventions. They're not based on what some donor may think is fun to do, but they're based on a needs assessment. All of the communities have gone through an MDG-based gap analysis to figure out what there is, what there should be, and how to achieve the gap. The other very important concept is adaptive implementation. We do not start out with a preconceived notion of what needs to be done and set it down. Instead, we learn by working with the community and adapting and adopting new concepts as the work reveals are necessary. All of the initiatives are community-led. This is not a rhetorical community-led approach, but it's based on complete participation. And it's done at a cluster level. Cluster meaning that it's a cluster of Millennium Villages. Each cluster, of which there are 14 throughout sub-Saharan Africa, each cluster is about on average 30,000 people. Some of them are 70,000 people. And the work is based on that scale. The other concept that's very critical, of course, is local capacity. There are no expats doing any of the work. All of the work, the management, the scientific team is done by local professionals. And then we have established already 5 years ago 3 centers, regional centers in Africa. One is in Addis, one is in Bamako, and one is in Nairobi. And those are also African employees, scientists, managers who do the operations of the Millennium Villages, and also they do policy advising for the region. The cost, although the project has been accused of all sorts of things, including gold plating, the cost is a very important component of this proof of concept, which is based on the fact that we think that it will take about $120 per person per year to get out of the poverty trap. $120 from all stakeholders, governments, local communities, existing partners, $120 total for 5, gradually decreasing over 10 years is what's requisite. Of the 120, the Millennium Village project gives the gap that's missing, which is 60. So $60 is available from the existing government and other stakeholders, and there's a $60 gap to get out of the poverty trap for the total of 120 that it takes for all the interventions. And so we bring in $60 and are very carefully monitoring that. And then the other hallmark of the Millennium Village project is that it's a very meticulously scientifically documented process. Just quickly, the Millennium Village project monitoring and evaluation is a relatively standard, robust M&E system with one major, I would say, added value, which is that in addition for it being an M&E system, it's also being used very much as a real-time management tool. So first there is the impact assessment, which are the household surveys, which are also surveys from all sectors, health, education, infrastructure. There's also biomarkers. We're measuring anthropometric measurements, blood tests, stool tests, urine tests. Those are done at time 0, 3, 5, and 7, and I'll show you some results of that. It's really the performance aspect of the M&E that I think is very interesting and very novel, which is that we have two sets of performance indicators. One is quarterly. There are 87 indicators that the management team for each cluster is evaluating and entering into an electronic record every 3 months. And those are things that cannot be really gotten from surveys, plus they're gotten much more frequently, which is more the facility-based output and activities component. And then there is another performance measure which is facilitated by the fact that now all the communities, of course, like everywhere in Africa, have telephony, mobile telephony, and so in our project the community health workers have a mobile phone, and using that mobile phone they actually gather a lot of data that is transmitted by SMS to the team in real time. So the community health workers, as they're going through their daily job, get vital information on deaths, births, diarrhea, malaria, malnutrition, whatever the case that they're dealing with at the household is very simply input into the SMS system, and therefore not only helps support the community health worker to do a better job because they have connection either by expert system or by actual speaking to a clinician, but it also gathers data that is then fed to the management of the cluster, and they can make real-time decisions and adjustments. And that, by the way, that system is called Child Count, developed by Matt Berg at the Earth Institute. And then, of course, the third prong is the process evaluation, which is the focus group-based qualitative information, the so-called implementation science, and that's also turning out to be an incredibly important, not just M&E for project purposes, but very much for improvement of real-time improvement of the management of the clusters of the Millennium Villages. It basically asks the kinds of things that help flesh out the impact pathway. Is the intervention leading to the impact, or I should say the other way around, is the impact that we see due to the intervention? What is the uptake? what worked, what didn't, how did it work, why did it work, for whom did it work, for whom did it not work. So it's this sort of process that identifies barriers, positive and negative synergies of doing all of these different interventions at the same time, and looking at lessons learned. The fourth component of the M&E is cost. We're looking at the breakdown of the stakeholders. You know, is the government really putting in its portion? The community, is it putting in its portion, mostly in kind rather than in cash? And so we're costing out after the fact. We're costing out to see what the actual reality is. The package of interventions is basically to make sure that there is increased food production. This is the 5 pillars of the interventions: increased food production, universal primary education, safe drinking water, a health system, a functioning, robust health system, connectivity consisting of road, electricity, telephony, and also IT, and business development. This is the intervention timeline. I just wanted to point out that the interventions are phased in, and here you have the first. It's really hard to see. The first 5 years. We're now at the end of 5 years, so we're now entering the second phase, 5 to 10 years. But the first 5 years. These were the interventions, and this was the sequence of deployment. So in agriculture, it was seed and fertilizer extension, which is like community health workers, but for agriculture, crop diversification, and now the phase that you don't see is off the slide is really taking these products and the agricultural successes and turning them into to agro-processing and agro-business. In health, again, there were certain quick wins, like bed nets, immunizations, vitamin A and deworming campaigns, which are very effective, and then clinic construction. And now we're focusing very heavily on professionalized community health workers. And our challenge for phase 2 is really to convert these components, which are now in place, and really making sure that it's a self-sustaining system, that it's not just a set of interventions and hardware, but that it actually is a system that identifies gaps and self-corrects. In education, in schools, staffing, and school meals, in infrastructure, water, sanitation, electricity, and then the business development is really the main challenge for phase 2, because now that the communities have in fact already achieved the point of food security, now the idea is to help go beyond food security. Now it's to make sure that the increased harvest that they've all had is converted into actual different forms of diversified livelihoods. I just wanted to, I know this looks messy and busy, but I just wanted to quickly summarize the health system that in the Millennium Villages has become sort of the focus of my work. The basic component of the health system is that we think of the health system as being deployed in